So I've spent the last month talking to folks in the mental health industry here in around Metro Atlanta. Counselors, some pastors who do pastoral care, folks who work for the government. And what I've discovered is that there are very few resources available for folks, especially without documentation, and especially after the passage of the State Immigration and Security Act, SB 529. There are all kinds of formal barriers. Before, anyone who was poor, whether they had documentation or not, could go to one of the community service boards, which are the county's offices or the county centers for mental health services, and they could get counseling, and they could see a psychiatrist if they needed medication, if they had a serious mental illness, and they could get medication really cheap. It was only $6, I think, a prescription. They have their own internal pharmacy, so it's all right there. And since the passage of this bill, the only way they can take folks without documentation is if they're in crisis, and there's such a shortage of clinicians who speak Spanish that it's usually about a month and a half to 2-month waiting list to even get an appointment. And after 3 months, after you've opened the case, you have to let them go because only crisis services are authorized for people who don't have documentation. So you usually don't have enough appointments to be able to even talk to someone if you've started medication to be able to tell whether it's working, or if the side effects are bad, or if it's not working and making you worse. And then once you've started the medication, unless it's one of those that is offered cheaply at Kroger or Walmart, you can't get it, and you can't get a refill of a prescription because you can't get in to see a psychiatrist again if you're past that 3-month window. So for folks who have serious psychiatric problems, there are basically no resources along the lines of medication. Now, I think at Grady it might be different, but in terms of the county offices, which is where most people end up going for mental health services, there's no resources. And then just talking to people, I've just been really struck by the fact that there are just so few Spanish-speaking clinicians available for this community, and so few Spanish-speaking social workers, and all the kinds of professionals that are in the front lines of human services. So I would talk to a pastor, and he would say, oh yeah, I know one guy, he's out in Gainesville or something, and that was it. And so that's a huge need. But along with all of these formal barriers, there are all sorts of informal barriers. So there are obviously high levels of anxiety since this bill has been passed in the community, because people are really afraid to kind of go out. Folks are really isolated, and people are afraid to have contact with the health services industry just because you still have to sign confidentiality documents that say if a court of law requires your confidential information, then it can, and so that's the exact thing that people are afraid of. And so because of that, even folks who have children who are born citizens and are able to access services aren't bringing in their kids as often because they're afraid of involvement with the government. And a lot of therapists that I talked to talked about increases in domestic violence and child abuse just because there's so much pressure on families in this community, especially since the economy's taken a turn down. And so what I've been thinking about is trying to think about what the role of the church could be amid all of this. And because the church and mental health services that are offered through the church, various churches in the Metro Atlanta area have a real position of trust in the community and have the potential to form relationships that government agencies just don't have in our current political climate. And they also have the kind of resources, if they are really attending to pastoral care and counseling, to be able to serve some of the mental health needs in the community. One clinician that I spoke to talked about how even the kids who the schools refer to her These are probably first-generation immigrants who are presenting with symptoms of all kinds of stuff. She said a lot of it is grieving. A lot of folks in these families are grieving, in these communities are just grieving huge numbers of losses. You know, so many folks, immigrants in this community come from rural areas and are used to having really strong family networks and social support systems, and they get here and they're cut off from those support systems and in a hostile political environment. And so the kind of hope that the church offers is that pastoral care and counseling can actually deal with issues of grieving and issues of finding identity in the midst of that huge shift. And so I think that a lot of these problems could be handled at a level that wouldn't necessarily require, you know, major psychotropic drugs or other things. So the church really, I think, needs to step up and really take on that responsibility until a political solution enables more resources or creates the possibility for this community to access more resources. And also, obviously, the church needs to step up in terms of public advocacy against these kinds of bills because of the human toll that they're taking on the communities in terms of psychiatric suffering and all kinds of other suffering. Because an entire generation of young people are growing up in these communities and inheriting these problems and not getting the kind of resources that they need to be able to flourish. So in spite of the very grim picture in terms of mental health realities for folks who are undocumented in the immigrant community, the church has a real potential to create change and alleviate a lot of suffering, I think. So that's the one good thing that's come out of that project. So you usually don't have enough